This segment of DelmarvaLife is sponsored by TidalHealth.
Having a healthy heart is something everyone strives for regardless of age. We understand many of the basics regarding what we need to do and what we shouldn't do to engage in a healthy lifestyle. But when it comes to cardiology, things are a little different between men and women. So helping us understand some of those differences is Dr. Aman Abu-Hanye with TidalHealth Cardiology. Doctor, welcome to DelmarvaLife.
Thank you, Lisa. Thank you for having me again.
Yeah, welcome back. So let's talk a little bit about the differences between men and women. Is it true that heart disease is often considered more of a threat for women than breast cancer?
Certainly, and thank you for asking this great question. Actually, heart disease is the #1 killer of women in the United States, rather the entire developed world. So according to the most recent statistic from the American Heart Association, heart disease is responsible for claiming the lives of 1 out of every 3 women. So out of 3 deaths in women, 1 of them would be due to heart disease. In fact, breast cancer is important, and we're saying that it's important to get your yearly mammograms. But to put things in context, heart disease by itself is responsible for more deaths than all cancers combined.
Wow.
All cancers plus lung disease plus many other causes. And more specifically in women, because in women it tends to be under-recognized and under-diagnosed, and it goes unnoticed for many years. And it's one of those diseases where if you don't catch it quickly and early, you may get into like the later stages where less things can be done.
Now, is it the symptoms of heart disease in women are different from the symptoms in men?
Absolutely, and that's also one of the reasons why it's under-recognized. So in men, we tend to see the classic chest pain where they clench to their chest, but in women you get some kind of like subtle or non-specific symptoms that would be like heartburn or even nausea, sometimes shortness of breath, sometimes as simple as fatigue or like pain in your jaw. And the next thing you know, you're having a heart attack.
Oh, wow.
So it's always important to keep that in mind when we're talking to women and assessing them, whether it's in the ER or in the office setting.
Can you discuss the contributing factors for the risk of heart disease?
Absolutely, and especially in women after menopause, that's when their risk actually kind of increases. And that's because as we age, we accumulate more risk factors. We're more likely to be overweight, have high blood pressure, high cholesterol, but also in women, they lose the protective effect of estrogen. So estrogen is very protective of the heart in that it maintains healthy blood vessels, lowers the cholesterol. So losing that effect of estrogen, and we see that especially in women who had an early menopause, who had a hysterectomy for whatever reason. So they had early menopause, they become at a greater risk of having heart disease because of losing the protection.
And of course, like any chronic disease, prevention is key. What kind of lifestyle changes can we make?
And this sentence is especially true in heart disease. The majority of heart disease can be prevented by lifestyle changes and basically preventive measures. So most importantly, we talk about quitting smoking, maintaining a healthy weight, doing regular exercise. We usually ask patients to do at least 3 to 4 times a week of aerobic exercise for at least half an hour, which is not impossible and can be arranged and they can fit it within their schedule. We also ask them, like, do whatever you enjoy. It doesn't have to be running or jogging. If you enjoy swimming, if you enjoy pickleball, if you enjoy tennis, do whatever you enjoy as long as you can get that activity. Also following a diet that is full of fruits and vegetables, avoiding processed food, excessive salt, excessive sugar, and of course, doing your annual physical exam with your doctor or with your cardiologist.
And of course, you have treatments available.
Definitely.
What are they?
So the treatment depends on the specific condition and also on what stage is this condition in. So it can, as I said, the majority of the treatment is just preventive and lifestyle changes, but when something happens, we can either treat it with medications like blood thinners or cholesterol medicines. We can also do procedures if medications fail to improve the symptoms. We can do angioplasty, which is putting a balloon or a stent inside the coronary artery to open up a blockage. Or furthermore, we can even send them for the cardiac surgeons who can do open heart surgery and bypass, but obviously that's for the very advanced stages.
Very advanced. All right. Well, thank you so much, Dr.
Thank you.
Abu-Hanye. And of course, go see your primary doctor if you have any concerns.
Absolutely. Thank you.